We're getting there. We're getting there.
I'm visiting your committee as usual.
As you, that's
She came downstairs this morning. She forgot her mom was there.
we welcome everybody.
A lot of big stuff today.
Yeah, it's going to be interesting. Going to be interesting.
Michael, what pair of glasses were you holding up versus the ones you're wearing?
My reading glasses.
Oh, okay. All right. I was like, wait a minute. Hold on. Okay. All right.
I refuse to get the readers. I'm not doing that. That would be yet another admittance of age. And I'm fighting that on all battlefronts. Thank you.
Just asking.
Has nothing to do with vanity.
You're not alone.
Okay, Mike, we are streaming live on YouTube. Guess whenever you and Janine are ready. Janine, do you guys have a quorum?
Hey, thanks, Ashley. Yes, Mike, you do have a quorum.
And Dr. Gilson, has he arrived?
Yes, he's on here.
Okay.
Yes, sir.
Let's get started then. Welcome everyone to this December 15, oh my, 10 days from the day, to the Public Safety and Justice Affairs Committee. Roll call, please.
Calling the roll, Mr. Gallagher.
Here.
Ms. Baker. Ms. Baker is absent at the moment. Mr. Tuma.
Here.
Mr. Brady.
Here.
Ms. Conwell. Ms. Conwell is absent at the moment. There is a quorum. Also like the record to reflect that council members Miller and Jones are in attendance.
Right. Welcome, gentlemen, as always. Do we have public comment?
Yes, Mr. Chair. 3 people submitted public comment on behalf of the Children's Law Center. Also, Ms. Peggy Iswick and Gabrielle Celeste regarding resolution number 2020-0288.
Okay. I actually had the time and opportunity to respond to 2 of the 3 of those. They're all speaking of the contract with juvenile court, which we'll delve deeper into when we get there. In the packet that you received, we have the minutes of our December 1st meeting. If they're in order, I'll accept a motion in a second.
Also move, Nan Baker.
Second, Tuma.
Thank you. All in favor?
Aye.
Aye. Against? Thank you very much. And welcome, Ms. Baker.
Thank you.
Resolution 2020-0288.
Resolution number 2020-0288, making an award on requisition number 3941 with WellPath in the amount not to exceed $4,566,261 for healthcare and management services at the Juvenile Court Detention Center for the period 1/1/2021 through 12/31/2023.
And who do we have from juvenile court?
Sarah Sijic, Deputy Court Administrator and Chief Legal Counsel.
Sarah, your last name again?
Sijic, C is in Charlie, I is in India, G is in Golf, I is in India, C is in Charlie.
Okay. And you'll be representing the court regarding this?
Yes, there's a few others on the call with me as well.
And who would they be?
Tom Rennert, Deputy Court Administrator, Detention Services.
Okay.
Hi, this is Tim Luby, the court's fiscal director.
Okay.
Sarah Baker, with Business Manager at Juvenile Court.
Okay.
Brandon Winarchik, Superintendent of the Detention Center.
Okay.
Jason Lanzo, Assistant Superintendent, Detention Center.
Okay. That all?
We've also asked WellPath to be available in case you have some specific questions that they might be able to answer.
Are they available?
Hi, my name is Zella Girola. I'm the Group Vice President for Eastern Region representing WellPath.
And your name again, please. You kind of faded out.
My apologies. It is Zella Girola, Z-E-L-A. Last name is G-U-I-R-O-L-A.
Okay. Thank you very much. As many of us now know and have been made aware of some concerns in the community of juvenile justice, there has been brought to the council's attention I've addressed the individuals that wrote us letters and have talked at length with them. I think they understand the position of the council and what our charge is. But I think to start, and I'm certain there's going to be more questions, if Sarah, if you could take us through historically going back to when Metro did have the contract, I believe it was, and then UH came in. Could you take us through the history of that to present?
So many years ago, we did have Metro in the detention center. And during those years that they were here, we ran into a number of issues with them. And what we ended up doing was issuing sort of an informal RFP process. And we looked at Cleveland Clinic and University Hospitals at the time to bring in a new provider. And I think that was around maybe 2018 that we started with UH, and we've had them since then. And we wanted to do our due diligence and kind of, you know, reevaluate what we were doing and how we were doing it here in the detention center currently.
Okay, if you would take us through the recent past history of this RFP process to fill the role now, starting with the RFPs that were originally put out and then the following RFPs and the rationale behind that.
Hi, this is Tim Luby. I think I can address some of those questions. So back in August of 2020, we began a new RFP to bring a medical services provider to be considered for the juvenile detention facility. That process ultimately ended at the end of August with no vendors responding to the bid. So that brought us to the end of August, early September. We then reached out to all of our local providers, University Hospitals, Metro Health, and Cleveland Clinic, and asked them why they didn't participate in the RFP process. Because if there was some unique characteristic that was preventing that, we wanted to find that out. Ultimately, through those dialogues, we discovered from Metro Health's perspective and Cleveland Clinic's perspective that they had no interest in providing services in a juvenile detention facility. So that fairly shortly ended our conversations with them. Of the three then that left University Hospitals, which we currently had a contract with and which we were seeking to improve upon because frankly there were some issues with our relationship with University Hospitals. We were then left with no local vendors that were able to provide services that we were comfortable with. And so we began an extensive research to try to find out who else could come to the table and assist us. Our detention facility, through contacting other juvenile court facilities, was able to identify a couple of other vendors, one of which was WellPath. There was a second one that was identified as well, which was named Advanced Correctional Healthcare. We then began because the first RFP had failed, we began a internal, more informal process in negotiating with these vendors to see if any of them would be interested in coming to the table and solicited proposals from them. That process took probably 2 to 3 months where we negotiated with each of the vendors. At the end of the day, we requested proposals from the 3 that we were dealing with, WellPath, UH, and Advanced Correctional Healthcare. Ultimately, we had a committee that evaluated those extensively, and that resulted in the selection of WellPath.
Okay. Historically, and I don't think this really has much to do with the contract where we're at right now. It certainly has something to do with how we got here. But originally you had Metro, then you went to UH. What was the problem with Metro?
I think that some of the issues that we had with Metro, if my memory is serving me correctly, is the staff issues that we had in the facility. We had a number of incidents with staff in our youth. and we weren't really getting what we needed from them. So when we issued the RFP back then, they actually came in at a higher price than UH did as well.
Okay. It seems just a little bit odd having trouble with Metro and then going back to them at such a late date in this, because it seems the contract, from what you're telling me, is we started looking in August, and here we are in December with one successful bidder anyhow. After seemingly and I understand the difficulty in getting anybody interested locally, especially in medical, in jails. I think this council has been made well aware of how difficult that is, considering the problems we had in the county jail itself. Let me ask the committee members if they have further questions.
Yes, Councilman Gallagher, Mr. Chairman.
Yes, sir.
I only read the public comments earlier today. I'm, as you might expect, amazed that we could find ourselves in this position even after 10 years. That our public hospital wasn't good enough, that we have a problem with University Hospital, and now we have a willingness to hire a service that has, you know, I would say some critics. And we are here at a special meeting, really, in a week that we usually don't meet, but there's nothing wrong with that. It's the fact that the contract is here at our, you know, on our porch, on our doorstep, you know, and they need this thing by the end of the year. I don't know what's the matter with these people. I mean, you know, I don't have anything to say to them. I don't know what they're doing and why they would think they could come in front of this council and having not been able to work with two stellar hospitals in this community, end up in a position like this. You know, I would just like to hear from the people from the vendor about their, you know, their own response to criticisms and what the facts are, because I'm not, I only know what I read, but it, you know, but I can't believe we're in this position again after this county has been in the situation it's been in for several years. It's unbelievable. So is the lady's name?
Ms. Girola?
Yes. Can she give us some help by why they have, you know, these critics?
Ms. Girola, could you help us here?
Hi, I do want to say it. We also have our president. I apologize. I don't think we got to hear him earlier, but our president is also on, Mr. Kip Hallman. And I would ask if we could allow Mr. Hallman to respond to this question.
Please do. Welcome, Mr. Hallman.
Thank you. Sure. I'm happy to. You guys hear me okay? My Zoom is a little splotchy here, it looks like, but so I appreciate your taking a few minutes. As Zella said, I'm president of WellPath. I've been involved in the organization as either CEO or president for, I guess, almost 8 years. And you ask a very interesting question, which is why has it been so difficult for the two local, very highly rated hospitals to be successful at this? And I would tell you first that this is very unusual work that we do. This is all we do. We do this in 34 states across the country, 15,000 employees. We take care of people who are incarcerated in prisons, jails, or in psychiatric facilities. There's a very unique population. It's very unique work. And we have people that have chosen this work and are committed to this work. And so I think it is very difficult for a hospital system the best hospital systems who, for whom this is a very, very small part of what they do and a very different part of what they do. So it tends to not get the level of attention that we would pay it, just because it's so different than what they do on a regular basis. They often have a situation where the nurses who have chosen to work in a hospital system are not necessarily interested in working in a correctional facility. All of our people work in correctional facilities. That's why they choose us, and they stay with us for very long periods of time because, again, they are committed to this work. I chuckled when you said we have critics. Absolutely, we have critics. We are, as I said, 34 states. We have probably, I think, a total of about 500 facilities we work with. Like any healthcare provider in any healthcare facility, Cleveland Clinic, Mayo, makes no difference. There are inevitably situations where there are bad outcomes. It's just part of healthcare. And we're working on a very, very difficult population. Now, I will say that is almost exclusively in our adult facilities. We have very, very few medical issues in our juvenile facilities just because it's typically a healthier population. You can imagine sort of in the adult facilities, the nature of the population we care for. So we have issues that come up. We also work with a very litigious population, healthcare or otherwise. And so we do have lawsuits. We have lots of lawsuits. But about 93% or more of those lawsuits are either dismissed entirely or settled with no significant financial outlay, less than $15,000. Very, very small numbers. Every year we have some very small number of cases where I would look at it, our people look at it and say, we did not do our best work there. And we, like any good health system, we pay for those situations. That's just what happens. But, we're not perfect, but we're very good at what we do. And I think that, I don't think you would find anybody who does the work we do, whether it is a local facility that does their own work or it's a company like ours, anybody who does what we do, you will find litigation and you will find critics. I've spoken with many of those critics. I've spoken with many reporters, and my message is generally always the same, that we do really good work. It's a very difficult environment. And the people like you who choose us don't choose us because, they're trying to save money. They choose us because this is difficult work and they're having trouble finding people to do it well. So when you look at the big systems we serve, Milwaukee County, if you spoke to the folks in Milwaukee, or Wayne County, Detroit, all of these places where we've taken situations where they've been really struggling and turned them around, they would tell you very quickly that the difference between what they were doing before and what they've been doing with us is night and day. And so again, we're not perfect. We're very good. And, it's the work we do. And we appreciate your considering us. So.
And if I just may add, as a side note, our intention is to continue our relationships with all the hospital systems that were named, Cleveland Clinic, UH, because of the delivery of care that we focus on with our patient population. So there'll still be some interactions, and there will be some times where we tie in together to provide that quality healthcare to the juvenile population. So those relationships will not go away. They will still be existing. And we have been in conversations with the hospital system to help with the transition and help with the relationship to continue to exist.
Mr. Brady?
Well, folks over at the juvenile justice system apparently, made this decision. I don't see how, I'm again, after 10 years, I can't believe I'm saying this. I'm astonished that this arrives on our doorstep, shortly before the end of the year. Now, somebody doesn't know what they're doing or isn't doing it well somewhere with no, I don't know these folks. But I would seriously say, I would say that given the situation the council's in, not having been, this having been discussed with us, I'll leave that there. That we, with no offense to these folks who I do not know, that, this contract should be, should not be, is it up for, is it a 3-year contract?
It's 3 years.
I just really think that we should go to 1 year, and because we are in a situation that I'm definitely not comfortable in. So, I'd like to hear from other members of the committee.
Mr. Hallman, before the other members speak, would there be resistance or concern with the 1 year as opposed to a 3-year, considering the position that we've been placed in?
We would strongly prefer a longer contract, simply because we'll invest significant resources to start up a program. It's just the way it is. And so if we had we would not agree to just doing this for 1 year. Just wouldn't be worth, all the effort we're going to go to start. Now, that said, my experience is that all of the contracts we have some sort of, just because of the nature of the entities we work with, these are county agencies, they always have the ability to terminate contracts. So it doesn't happen very often, very rarely, but we would like to know that there's an expectation and a commitment that we're going to try to work together long enough to actually have it make sense for both of us. So yeah, I think that's how I would say.
Sarah Sijic, what is the out clause in the contract?
There's a 30-day no fault clause, written notice by either side.
Right, and that's not unusual.
Okay. Other members of the committee, questions?
If I may, Chair.
Ms. Baker.
So just so I'm understanding this right, and I also got the letter and read it thoroughly. The person to ask about the Juvenile Justice Center decisions that brought us here today, is that Sarah, or is there another representative that's here to speak on behalf of the Juvenile Justice Center?
We have this is Tim Luby. We have a number of individuals, Commissioner, that can respond to specific questions. We have actually people from the juvenile facility, the detention facility, that can give you specifics if you want to ask them some questions. I'm here on behalf of the fiscal department, and then Sarah Sijic can answer any legal questions that you might have.
Well, whomever can answer the councilwoman's question, please answer.
Okay, thank you. Just wanted to make sure they were here and ready. So we've had two, as was stated by President Brady, we've had two credible hospital organizations that have been with us now for quite a while. And both were identified as having issues. One was staff issues. I haven't heard what UH's issues were, only that there were. So going into a third organization, have we identified what the issues were for both Metro and UH so that we're not dealing with the same issues again with WellPath? Does WellPath understand the expectations of the detention center and why we have failed up till now with two hospitals that were in place? I heard about the difficulty and that this is an environment that takes special care, but still, what were the issues made part of the contract with WellPath so that we don't repeat what we've experienced over the years?
I'll try to respond to your questions, Councilwoman. With respect to Metro, I think they were different certainly from university hospitals. Metro had no interest in contracting with us, so they weren't even at the table for us to negotiate with. They said, we're not interested in being in a juvenile detention facility. So despite our best efforts to bring them to the table and engage them, they said, we're not interested. Now turning.
Let me interrupt you. It was said earlier that Metro, they had issues, which is why they went for an RFP after Metro, while they had Metro in place. So it was on the counties, if I'm understanding what I heard, it was the county's part to look for another hospital, which UH then stepped up. So there were, beyond what Metro said they really didn't want to participate, what made us look further beyond Metro, and what issues were there that related to staff that you said was different than UH's issues?
Sarah Baker, can you speak to that?
So in regards to the issues that we had with Metro staff, back when we did have a contract with them, we did put some language into the new WellPath contract that discusses our ability to, if we're having issues with a particular staff member, we can go to WellPath and say, hey, you know, we're having issues with this staff member, we need them removed from the facility. So we did add that into our new contract to try to assist with that issue that we did have with Metro.
Okay, so that was something that was a particular sticking point with Metro, that they were not cooperative if there was an issue with one of the staff members.
Yes.
And is that pretty much why we looked further beyond Metro, or were there other issues that we just could not come to terms with?
That was one of the major issues. And then secondarily, this is a product that was never really competitively procured at the time. And it's a high dollar value, so the court wanted to do its due diligence to make sure that we were getting the best services for the kids and for the county in general.
All right, so moving on to UH, which was different than the issues you had with Metro. You know, those issues, have they been identified and given to WellPath, just as you have the now identified the staff member that can be removed? Do you have issues that you've learned through UH that you've also included in WellPath's contract?
We have. There were a number of issues that came out of our experience with university hospitals that we both put forward in the RFP process and then moved forward into our contract with WellPath. Just to name a couple, we had a number of billing issues that related to the university hospital's contract. We've fixed those going forward. We also had issues with accountability with UH in the sense of, even though the contract required certain attendance levels by their doctors, we found in practice that those doctors were not showing up and providing the hours that they were supposed to. And so those were issues that we also addressed in the contract to make sure there was no ambiguity.
All right, it's curious that UH, who is in the business of healthcare, would not have doctors available and accountable for those that they're to serve. But that's the problem that you encountered with UH.
Correct.
And if I just may, to WellPath, is there anything that you've heard from Metro's issues and UH's issues as far as billing, appropriate doctors there when needed, removing staff members, or when not appropriate, maybe no fault staff members? There may be an argument there, but there's just a removal if we wanted, the county felt it was needed. Any issues there with you and how you do business?
No, as I said, I think we're very accustomed to this setting and this type of work. And I think these are the kinds of things that we take seriously. And, you know, somebody asked like what our expectations are. We expect that every shift, every day is going to be filled by the right kind of person, and they're going to do good work. And that's the most important thing we do every day. And our doctors absolutely are expected to be there. This is important. These kids deserve good care, and that's what we do. So no, I didn't hear anything that causes concern.
Well, that's all I have for now, Mr. Gallagher.
Other questions?
Mr. Chairman.
1 minute. Anybody else on the committee? We okay? Okay, Mr. Miller, go ahead.
Okay, I'm just going to speak briefly because the council president said pretty much the same things that I would have said. But I just really think that there's a local solution to be found, and that that the benefits that having people who are local and know the community would outweigh the specialization aspects that are being presented here. And I also think that that to the extent that there's medical issues, a huge number of those issues in this population would involve mental health and addiction disorders. And so I think we should think about whether there's some way we could get the Adams Board involved as part of a partnership. And in summary, like the council president, I would be interested in a one-year contract, and that we take this time to go back and see if we can put together a local solution. Thank you.
Unfortunately for me, and I think fortunately for the county, I have quite an extensive background in trying to find a local solution for this sort of service in a jail facility. And it took me and others on the council, 2 administrations, about 6 years of fighting, begging, pleading. And even at that, we got super lucky that the board at Metro changed, the administration at Metro changed, and super duper lucky that Dr. Boutros did us a personal favor by delving into this sort of medicine. I don't anticipate in a month or two, and quite honestly, in 2.5 weeks when this contract is up for who's in there now, that's going to happen. So we are where we are. We have in front of us what we have in front of us. And I would suggest that we deal with it. And Mr. Holman, I think you can clearly see the distress that the council has. This has no reflection on you or your company. It has no reflection on UH, Metro, or the Cleveland Clinic. I think the juvenile court had their bites at the Metro apple, and I don't think that apple is going to be presented again. They had their bite at the UH apple, and I don't think the UH apple is going to be presented again, regardless of what we say, ask, or beg them to do. So again, we are where we are. I would ask you, sir, if it were in your heart and in the best interests of Cuyahoga County and your business personally, if we could seriously look at a 1 year, ideally, if that's unacceptable and you'd be willing to walk on that, I would consider that we would then be at requesting a 2-year contract. I don't know if the rest of the committee would be comfortable with that, but I can assure you and the rest of the committee that we've been placed with our backs against a 2-week wall, and we have to deal with it. So, Mr. Holman, I ask your guidance.
Sure. Yeah, no, look, I recognize that this is an uncomfortable position, and to the extent we have anything to do with getting to this place, I apologize. I don't think so, but I think it's just the process took time to go through.
You did not.
Oh, okay. So I understand that. And I would ask the same understanding of our position, which is that, we will invest significant resources in getting this started correctly over the course of the, New Year's holiday, or all this stuff we'll do it right, and it'll be done well, even in COVID. We've done this, I don't know, a dozen times this year during COVID, but it's really hard for us to look at a 1-year opportunity. We just wouldn't. So let me put it this way: if the county, if the original ask would have been, "Will you do a 1-year contract?" It would have been a very short conversation. No, we wouldn't. I don't think we'd even do a 2-year contract if you came to us in the beginning with that. Our typical relationships are, I would say, 3 to 5 year contracts with extensions, and that's pretty normal. And I think there's a recognition that, number one, this is a heavy lift and we don't want to, it's heavy lift for us. I think the other recognition is these are challenging things to change, right? So you're not going to want to do a lot of changing.
Right.
Now, that said, I would probably be willing to do a 2-year contract, but I would want to see in that, what we typically see is extension opportunities, mutual extension opportunities beyond that. So typically 2 years with maybe 3 1-year extension opportunities. Again, for us, it's about intent. It's about what do we expect from this? Because I recognize you have a 30-day opportunity at any time to say, wow, University Hospitals has shown up. They've knocked on the door and said, we're ready now. We want this. You can drop us anytime, 30 days. We recognize that. That is a very common thing. It doesn't happen typically. We typically have, as I said, relationships that go for decades. So that's what I would expect. For us, we would want to see at least 2 years with some extensions attached to it. And that way we're giving each other a commitment, sort of like a marriage, that, hey, we're going to be in this for the long haul and we're going to take it seriously. That would be
more like a shotgun wedding to me.
It is, Mr. Brady, it is. What are your thoughts?
Mr. Chairman, I'm going to support your leadership. This is quite difficult, and we find ourselves in a tough position if they're willing to go they're willing to go for a 2-year. I'll support that, and the council will have to monitor this situation. This is not, again, this is just quite unusual. The fact that there could be a problem with our public hospital, which obviously, provides healthcare in our jail system after quite a bit of controversy that somebody might have heard about. And then we have UH, which is a stellar hospital. And in both cases, I'm just not buying what the folks over at Juvenile Court are saying. So, we have to have a contract. We have to have health care for these kids. And somebody has let us down very badly somewhere along the line. And they're not the county council. So, I'm willing to support your leadership. It's almost impossible, to find an ideal way, forward. But these folks here, don't know them, could be, I don't want to treat them with disrespect, but they're going to have to understand that even though it's not their fault, it's somebody's fault that this is in front of us, with only a few days to go. It's somebody's fault. And, but our job, of course, as usual, is to take care of these issues regardless of who screws up. And so, I'm willing to support your leadership, whatever you decide, Mr. Chairman.
Well, if the committee would listen to what I would suggest, Mr. Hallman, and then obviously give me your input. We're here to protect the taxpayers and the treasury of the people, as you well know. And you have a duty to protect your business. And I would appreciate it if we could do a 2-year with the understanding that after 1 year, that you would go back into negotiations with the juvenile court for a 2-year extension, thereby giving you that 3 years after 1 year, total 4 years if everything's going well. I would assume that would be commitment enough from us to entice you to at least roll the 2-year dice with us. And after 1 year, pretty much know where you're going in the future with us, if there is to be a future. I will stress that while the suggestions are ideal, that we look locally, I can 100% guarantee the committee that that's not going to happen. And having struggled for the 5 years plus that I did with other members of this council, with Metro's past board and administration, and have gotten as lucky as we got and to where we got to was almost a miracle. I would suggest that we are in a position right now to, number one, protect the welfare of those in our custody, and number two, to protect the treasury of the people, and number three, to fix what obviously and deal with what obviously is a problem placed upon our plate at a very late date. Mr. Hallman, if you would agree to that, I'll get my committee to tell me how they feel. I think that's fair and equitable from where we're at. Mr. Hallman?
That's fine. But I'm, again, just to be clear, we have similar discomfort in that our folks have already been doing the work necessary to transition. This takes more than a couple of weeks, as you might imagine.
Understood.
So they've been doing this without a contract on good faith. And so, I think good faith is required on both sides, and I'll be fine with that.
Thank you, sir. Members of the committee?
Mr. Chairman.
Mr. Tuma.
Thank you. Could you, if you could, I understand, given the circumstances, I know you're trying to work with these folks from this company here, and could you just refresh us as to what contract terms you suggested, or
what I would recommend, because as Mr. Hallman states, and what we have learned with our dealings with the transfer of care at the jail with Metro, there is upfront costs that are rather substantial. I think what would be fair is if we had a 2-year deal with Mr. Hallman's company.
So
with
you're
the
suggesting
understanding that after 1 year, if everyone is comfortable with the product that's being delivered, that they would have the ability to go back to juvenile court and negotiate after 1 year a 2-year extension, which would give them the 3 years that has been offered in the original contract. It's a total of 4 years, or it's a total of 2 years if it doesn't work out. If it does work out, they get the comfort of the 3-year contract, which is what we do. That's been our charge throughout. We don't usually go beyond 3 years on contracts. And I'm just trying to find that middle ground where we're comfortable, the juvenile court's comfortable, and they're comfortable.
Yeah, Mr. Gallagher, if I could ask somebody from the juvenile court, maybe one of the attorneys, what has been the practice in the past with the previous medical facilities as far as the contracts go? One year, 2 year, 1 year plus an extension. What's it been?
Sarah Baker, do you want to speak to that?
Historically speaking, it's usually started out as a 2-year agreement, and then we've, done the extension for 1 year afterwards.
Okay, and Mr. Gallagher, is that what you're recommending? Or are you recommending 2 years afterward?
I would recommend it too, so we could debate. They could legitimately debate a 3-year deal. What we're dealing with right now, what I'm being told right now, a 1-year deal is not going to get it done. Unless somebody on this call can tell me where we're going to get health care in 2.5 weeks for the juvenile court, I'll stand down from my proposal. I think from our perspective, we have to do what we have to do to get this done. We could go to a 2-year with the promise of extensions of a year, or we could go to a 2-year with, after 1 year, understanding that they could negotiate on top of the second year 2 more years, which would be the 3-year total that we usually do.
Okay, and who's going to do those negotiations? Somebody from the juvenile court, or am I going to do it the week before Christmas?
We have a stellar law department that I'm certain is just chomping at the bit to have some work to do. I would assume this lies in the lap of juveniles law department. And I would also assume that it wouldn't be difficult to do over the holidays if indeed that's what has to be done. Because guess what? This isn't my problem that I created.
We can certainly, from a juvenile court's perspective, take care of the contract revisions. So just so I understand procedurally, so we could probably get this turned around in a day or two, because all we're really talking about is a single term of the contract. Procedurally, what's the next step? Presuming we get this done by Thursday or Friday, how do we proceed from there? If you could advise.
Well, what we could do, if we're all in agreement, is we could move it out of committee to be heard Friday. We can amend it Friday, or we can amend it today. I would prefer to amend it for Friday to get this thing done and to have all sides in an understanding as to where we're going. So my thought would be to move it out of committee today with the understanding that it will be amended at Friday's meeting and passed under emergency. Does that sound correct? How you feeling about that, Mr. Miller?
I think that it would certainly be reasonable to pass it out of committee today, and if we're going to do an amendment, to do the amendment on Friday when we've had a chance to look at the language and make sure it's right, and also we could pass it on second reading suspension at that time. The only question that I would raise is that that usually the process of negotiating an extension is not something that's done in a few days. It usually takes a longer amount of time when all the attorneys get involved. And so if you're talking about waiting till the end of the first year and then negotiating a 2-year contract extension to make the total 3 years, by the time you get that negotiation done, you may be well into the second year. So I just think there might be a little bit of a timing issue. But other than that, as far as the council process is concerned, I agree with you.
I think the juvenile court will be able to handle this. I anticipate Mr. Hallman's legal department will be able to confirm whatever they come to. I was suggesting a reopener basically after the 1 year for a 2-year extension. If they want to do a 2-year with 1-year extensions after that, I don't care how it looks, but I want to get something past Friday that.
Mr. Chairman.
Mr. Tuma.
Yeah, Mr. Chairman, I mean, I would feel more comfortable going with a 2-year contract with an option for a 3rd year. And then they can negotiate.
I wouldn't normally disagree, Mr. Tuma, but as an attorney and a good attorney that you are, you understand we hold 0 cards. 0.
I'm fine with that. I'm fine with that. I don't think it's materially different.
Okay, I appreciate that.
All right. Okay. No. We somehow you came you came up with that one-eyed Jack out of your sleeve.
All right.
Mr. Hallman, would that be agreeable to you to have your lawyers discuss with the court's lawyers and have an amendment prepared for our Friday meeting? Because if it doesn't happen Friday, it's not going to happen.
Right. So I guess, again, I don't know the procedure. So what I'm hearing is that we just somebody needs to redline the current agreement that is in front of us. I've not actually read through the agreement. I presume it's got just a simple term and termination kind of clause. And somebody, if your side could just redline whatever it is you want the language to be, kick it over to us. Our folks can turn it quickly. So
okay, we'll charge the juvenile court's law department to handle that. Is juvenile court agreeable?
Absolutely, we'll make it happen.
Thank you, juvenile court. Thank you, Mr. Hallman. Thank you, Ms. Girola. Are there any further questions regarding this and the procedures that we'll take to correct all these problems?
Just one quick question, if you don't mind, Chair.
Go ahead.
We talked about the scheduling of the contract, but what about the amount? We didn't hear. This is a private company that we had both Metro and UH public companies before. Is this a competitive bid?
It was not a competitive bid. The competitive bid process failed, which RFP is. I'm hesitant to say this in front of WellPath, but they actually were substantially cheaper than the other public entity, which was UH. Their basic bid was $1.5 million. That did not include $275,000 of pharmacy care. Our WellPath bid was $1.4 million for a single year, and it included our pharmacy coverage. And frankly, it also did not include the more than $1 million that we spent with UH for out-of-care facilities. So at the end of the day, the one option we had with UH was substantially more expensive than WellPath.
Okay, thank you.
Any further questions regarding this? Okay, hearing none, I would recommend we move Resolution 2020-0288 to the full council for second reading consideration this Friday, as it will be amended. Do I have a second?
I will second. Ann Baker.
Any further discussion? All in favor?
Aye.
Aye. Opposed? Thank you, everyone concerned. This is a very difficult way to go, but we're hopefully going to get there Friday. Thank you.
Thanks.
Thank you.
We have no other legislation on the docket, but we'll discuss. Is the sheriff available? Who from the sheriff is available? Anyone from the county jail?
Councilman, this is Michelle. I believe Bob Corey is on, and I'm not sure, but I also see Rhonda Gibson on. I'm not sure if who is speaking on behalf of the sheriff. I'm not sure if the sheriff is available.
I just wanted to make sure that they're listening, because we're going to go with the medical examiner's report, which will be touching on some of the COVID issues, and that segues into the concerns at the jail. So if they'll stand by, I'd appreciate it. And Dr. Gilson, are you available, sir?
Yes, I am.
Thank you.
I apologize. I sent some slides over, but today is going to just be more of a talk. I took advantage of the opportunity to kind of do a year-end summary of a couple of different areas that fall under our jurisdiction, and maybe clear up some facts and myths about COVID. And then at the end, I can certainly address just the planning process we're looking at for COVID as it would impact what has lately been called the death care industry, especially the funeral homes. To start off, the four topics I'll cover are suicide, drug overdoses, traffic fatalities, and homicides. And I think one of the things that I've heard, at least, is that suicide deaths are up with COVID, and that isn't actually true. Our projection for the number of suicide deaths this year is about 175 to 180. And that's actually down from the last 2 years. There were 200 suicide deaths in 2019 and 214 in 2018. Go back to 2017, it was about 175 that year. I think, one of the things I would say is that the number of suicides is higher than it has been, but it's not a new problem. And my personal feeling is that that's probably more a reflection of the length of the opioid crisis. About a year ago, CDC published a finding that the last 25 years have seen a significant rise in suicide, which is about as long as the opioid crisis has lasted. And if I go back to when was the last time we saw 2 years back to back where we had 200 or more suicides, it was actually in the early 1980s. So we've been there before, but it's certainly not a positive number. But I would say that the kind of armchair philosophizing about, COVID's causing all these people to take their own lives isn't really supported by data. I'm going to move on to drug deaths. And this year we're projecting somewhere between 600, 620 overdose deaths based on where we are currently. Some of that will probably fluctuate over the early months of 2021. That represents about a 5% increase over 2019. And 2019 was a slight elevation over 2018. 2018 was a very anomalous year in that our drug deaths plummeted from a record of 727 in 2017. The big game changer that's kind of remained at the driver is fentanyl, and that really rocketed our overdose rates to nearly double in 2016. So in some ways, we're not as bad as we were a few years ago, but we're worse than we were a year or two ago. I would say in terms of trends that we see, fentanyl has been relatively flat in terms of the number of people who we're projecting will fatally overdose from that. The big change I think that we saw in 2020 was carfentanil, which is kind of the super fentanyl. It's 100 times the potency of fentanyl. Pretty much vanished with the onset of the pandemic, likely because there was just so little traffic from elsewhere, including China and south of the border, where that big supply distribution was coming from. The other thing I would mention just quickly is we have a lot more methamphetamine in our drug seizures. It's not as lethal a drug as the opioids like fentanyl. And most of the time when we see it, it is in combination with fentanyl when we have overdoses. So I would say that, the numbers haven't changed dramatically. There's probably some impact from COVID in terms of what are more prevalent drug problems. But again, the idea that, there are scores more people overdosing on drugs because of the pandemic is probably not supported by data. Next, I would talk about traffic fatalities, and there was a early, body of anecdotes that more people were doing crazy things on the highways because of the quarantining. I don't know. We have a current projection for traffic fatalities for the county of about 140 for the year 2020. That is substantially up from 2019 when it was 106, but as recently as 2017, we've had 138 traffic fatalities. So I think that's bounced around, but whether or not the bump we're seeing now is COVID related and crazy behavior on the highway is certainly still a possibility. I would say, and I saved the worst for last in terms of these four, this year in terms of homicide deaths, it is just breathtaking. We will probably have about 250 homicide deaths in Cuyahoga County by the end of the year. Through November, we had 235 deaths that were certified as homicide. That's the highest since 1991 when there were 235. And passing that number, now we have to start to go back into the early 80s, late 70s to see comparable numbers. And a lot of what's driving this is, violence in the city of Cleveland. The population was substantially larger at that time. So just a truly bad development. the kind of big players are still going to be firearms, and the big victim profile are young black men. That hasn't changed. I've heard people kind of reference that homicide numbers are up across the country, which is true. But I would say, as a point of reference, Los Angeles had just broken 300 homicides in the middle of November, with a population of almost 3 times as large as ours. We kind of behave a lot more like cities that have traditionally very high homicide rates, like Chicago and Philadelphia. And just locally comparison, through mid-November, Columbus had 144 deaths registered as homicide, whereas Cleveland was substantially higher than that. They were already into the 180 range. So I think that, what we're seeing is not good news. To what extent it's influenced by COVID, I do not know. But the profile of victims hasn't changed, dramatically. And I think it's kind of a misconception I hear sometimes. It's like people are more at home, with their families or something. It's not domestic violence that's driving the spike. So I don't know if it's, peripheral issues that COVID impacts, but it's certainly a trend that's not trending in a good direction. We have, just to close up quickly, been monitoring the number of deaths that get reported to the ME's office. And that is a number that usually represents about 40 to 50% of all of the deaths in the county. Traditionally, even at the worst peaks in the opioid epidemic, that number was in the low 20s per day. We have been averaging for the last 2 weeks about 30 or more deaths reported a day. So that's a 50% increase. And that was our trigger to bring the refrigerated vans from the state to our facility to augment our capacity for body storage. I reach out periodically to our partners in the funeral homes. They're currently saying that they're working kind of at high capacity, but not overwhelmed. We have worked with the EMA to create a plan whereby they will funnel requests from funeral homes for additional storage, and we'll do the best we can at the ME's office and work with our state partners as well when that capacity gets overwhelmed, though I'm certainly hoping that doesn't happen. That's everything I had to say. I know you love my graphs, but I apologize I couldn't do any of them today from other commitments, but I'd be happy to answer any questions. Thanks.
Thank you, Doctor. So the advent of the storage trucks was in reaction to the homicides that we were having?
No, it was actually a reaction to a metric we follow, which is how many deaths get reported to our office. So this would include deaths we accept jurisdiction on, deaths we decline jurisdiction on, and the traditionally that represents about 40 to 50% of all the people who die in Cuyahoga County. Most people don't wind up in our office. The homicides, it's a concerning, trend, but it will be pretty much, no more than a fraction of the number of total deaths that occur in the county, because most deaths are natural deaths that don't even come here. We don't have the capacity to monitor COVID deaths per se, because most of them are natural deaths that aren't reportable to our office unless they occur in kind of a care setting. So a nursing home or someplace like that will frequently report them. Or if there's some associated trauma, if somebody fell and broke their hip and got an infection with COVID in their recovery period, that would be something potentially we would know about. Those numbers are way up too, I should say, the COVID deaths that get reported, but we're not capturing all of them. And that's an unfortunate, tracking problem. We use this report to our office as a surrogate, because trying to pull out every COVID death that gets certified in the county would be a really hard job to do, actually.
All right. Questions from the committee? Anyone not on the committee? Doctor, thank you very much. Looks like you're getting off easy today. I appreciate your time. I appreciate the service that you provide to the citizens of Cuyahoga County, and I wish you the merriest of Christmas and a happy new year.
Thanks very much. Merry Christmas to everyone there too.
Take care.
Bye now.
Next on our discussion agenda is the after action report. We were waiting for the release of the Cleveland Police Report. And I don't know what direction we're going to go in here, but I'm going to tell you what I think right now, where I'm at, is that having read the Cleveland report and juxtapose that with the sheriff's report, it raised some serious flags. There are some instances where we're still debating on what might have happened. I would be less than honest with you, having looked at the Cleveland report and put it up against the sheriff's report, to tell you that I'm comfortable with what the sheriff's department provided us. I think the Cleveland report, with using the outside eyes of retired Ohio Highway Patrolman, was helpful, and their report pretty much reads like an Ohio Highway Patrol report in detail and presentation. I don't know in the instances where things are not lining up, who is wrong or right, who may be fudging the truth or not. I'm not in a position to make that decision today without personal discussion with Cleveland, the police chief, and those that were part of the reporting process. On the same side, I don't think it's fair that with the news that our sheriff is retiring and moving on, and for all intent and purpose, no longer going to be participating in anything to do with Cuyahoga County going forward, and with a new sheriff on the horizon, whenever that happens, I will assume that's going to be within the next couple weeks at the most. I think it's probably fair to all parties to allow the incoming sheriff and his administration to look at both reports, figure out where we're at, redo the sheriff's report of the previous sheriff. If he agrees with it, that's fine. If he wants to change it or she wants to change it, that's fine. But I think we need two professional reports that better say the same thing. And if they don't, we're going to go down a path that I don't think we need to go down. You know, there are substantial differences, and you know, we have people saying two different things. So I don't know what the committee would like to do. Anyone that has any concerns or questions, please feel free to move forward. I personally am uncomfortable doing that without the necessary means of having an available sheriff that's going to stand by a report, and the potential of bringing in Cleveland to argue their position. The county of Cuyahoga was asked, and we participated in helping vendors in downtown Cleveland to a substantial amount of taxpayers' money because of damage done. I think there are legitimate and serious concerns of the actions of the Cleveland police or lack thereof. I think there are serious concerns and actions of our sheriff's department that I will assume there are answers to these questions, But I just don't feel comfortable without it, without the new sheriff, new eyes on this, looking at that report and standing by it. I assume Cleveland will stand by theirs, especially because they had outside eyes on that and participating. I'd like to hear what the committee has to say. Anyone?
Yeah, Mr. Chair.
Baker?
I agree with what you just stated. I do believe that we need to get a new set of eyes on this next year when we do have a new sheriff. I guess the Cleveland Police had the luxury of being able to read our sheriff's report.
That they did.
Yes, so, which we did not have that luxury of reading the Cleveland report when that was written. So I guess if I may, and I don't know if anyone's there to answer, but before our sheriff leaves us, is there anything in the report now that the Cleveland report, especially as detailed as it was, is there any changes that you would like to bring to our attention that before you leave, you have an opportunity to revise? I guess that would be really the only question.
Good afternoon, Councilman. Can you hear me? It's Captain Jerome.
Yes, we can hear you.
It's Captain Jerome, Sheriff's Department. I'm here with some of the command staff that helped put the report together, including Captain Peters, Lieutenants Griner, O'Connor, and Kozub. I think the discrepancy in the two reports is that we did a separate report that includes our use of force. We had 13 deputies involved in the use of force, which is 13 separate incidents. I think the only thing that we would add to this, our after action, would be just to add that in there specifically for you to see with the timeline of the events that happened. But right off the top of my head, that's probably one of the things that maybe we can add in there for you.
If I may ask, Captain, are there parts of the police report that you disagree with, and that when we have a fresh look at it in January or February of next year, that we will hear perhaps some differences that are now in the sheriff report that will be changed? I guess this is an opportunity.
Are you referring to the Cleveland report or ours, ma'am?
I'm referring to your report.
I don't think there'll be too many changes. I think we can maybe just add some things in there that maybe you haven't seen based on what I just said, that we did do individual use of force reports, and those weren't in our final draft.
And do you see differences from your report to their report, or do you think you're just writing it differently?
I think it's just writing it differently. I had a chance to review theirs, and I think it does give an accurate description of the events that took place. So I just think it's more wording and how it's presented that makes the difference.
Okay, Chair, I think that, we'll have another opportunity when we have a new fresh set of eyes on it, as you suggested in first of the year. And it's good to know that, Captain, you stand by the report and only think that it's language differences and not content. And that if you were both to write this report together, you and the Cleveland Police, it sounds like you're saying you would agree, and I guess I'm not sure if they would, that you are all on the same page. At this point, I'm not sure that that's what I'm hearing, but it sounds like we're going in that direction. So I don't know if there's anything more we can do today.
Mr. Chairman, this is Bob Corey.
Yes, Bob.
Just want to offer that we can immediately provide the committee those use of force reports. They have been reviewed and partially redacted by the law department, so they're ready for distribution. And we, regardless of what you want to do in the future, Mr. Chairman, we can provide those reports to you today.
That may be a big help to highlight our position, so to speak. I'm not casting judgment on anyone here. I just think it's really important that the new sheriff take a look at all of this with you report back to us, and any concerns going forward, we can address at the time. That seem fair?
Yes, sir.
Yes, sir.
You good, Bob? Anybody-
Absolutely. And I will send those reports now.
Okay, anyone on the committee or visiting the committee have any concerns or questions?
Mr. Chair.
Yes, Mr. Miller.
First, I'd like to say that I support the direction that you are taking as far as the timing is concerned and looking at the differences between the two reports and getting a fresh set of eyes. I totally agree with that. The one thing that I would like to say at this time is that I think there are two things that could be surmised from both reports where they're not different. And the first one that I would say is that you could surmise from both reports that not enough attention was paid to what was going on around the country at this time. And I think that should have alerted us to the possibility of a much more serious incident than what we were preparing for. And that's something we should keep in mind in the future. And the second thing that I would say is that it is, of course, important that we protect our public facilities when any incidents like this arise. But it's also important that we protect our businesses, and I don't think enough was done to try and head off some of the damage that was done in the business community. And I think that more thought has to be given to how to do that better in the future. Thank you, Mr. Chairman.
And I would agree with that. My other than some of the problems that, you know, one report saying one thing and it's getting a little different. The other report was the timeline after the Justice Center events and then what happened with downtown. Who talked to the governor? When did they talk to the governor? Did they talk to the governor? Why did it take the National Guard so long to get into Cleveland? Why wasn't that call made earlier? If you go to the Fusion Center reports, it's clear. We all knew something was going on, bigger and certainly not friendlier early in the morning. And it just continued to grow. Hey, mistakes are going to be made in instances like this. I understand that. And this isn't a finger pointing exercise. I just want to know those at the top that had the ability to make decisions, did they? And I'm not comfortable right now knowing what I know, which is, to be honest with you, a little bit more than what's in the reports, that those at the top, and I'm not talking about anybody in the county, those at the very tip top did not make the call necessary, and they need to clean up what they need to clean up. We can certainly do a better job. We can always do a better job. It's never going to be perfect. And all we can do is get better from what we can learn from this. And hopefully we'll learn from this. So going forward, I think that's a good plan of action. I think it's fair. I don't think it's a burden to the new sheriff. As a matter of fact, I think it will allow the new sheriff to get deep into the weeds of where we are at, what we dealt with, and what we can do into the future. So I think it'll be a positive exercise, and it will calm some of the concerns I think that the council might have regarding the two reports. So I think that's the best way forward, and I hope everyone would agree with that for now. So any further questions? Okay, thank you. We'll leave it at that, and we'll move forward. We'll have new leadership, and I would assume new committee chairs If someone's different on safety, they will have the ability to move this forward or do with it as they wish. And again, I thank everybody for participating. Finally, in the county jail, the COVID outbreak and the subsequent order and lawsuit that were filed by the county and presented by the sheriff to release inmates. If somebody could take us through that and bring us up to speed and the thought process behind it, which before we even talk, I 100% agree with. I think the state of Ohio Department of Corrections is not been our friend throughout this, even before COVID. Who is to speak on the COVID situation and those other items I mentioned?
Good afternoon, Council Chair Gallagher and Council members. Rhonda Gibson, Administrator of Corrections, Sheriff's Department. As far as the current condition of COVID inside the Corrections Center, the latest numbers that I have is 298 COVID positive inmates in our custody. Metro Health is, of course, taking care of the medical needs of those inmates. So far, we've been very fortunate to not require much of a high level of care for those individuals. We also are experiencing significant absences due to COVID of our staff. If I look at the HR's list, current list of staff who are out because of COVID-related reasons, it shows a number of 69 staff members. That does not include additional people who are off for other illnesses or some other leave of absence, etc. That particular situation is what led to us accepting the assistance of the Ohio Department of Rehabilitation and Corrections offer to relocate some of the National Guard working in their facilities to us. We were very pleased to receive that assistance. A site visit by Department of Rehabilitation and Correction and Ohio National Guard leadership was held on Sunday with my leadership team to work out some of the logistics of them bringing soldiers to us. The soldiers will specifically be at our facility on Wednesday. We will conduct orientation with those soldiers. Thursday and Friday will be basically shadowing of those individuals to learn some of the basic tasks of our jail. Correction officers will be used in the most specific of positions that require knowledge of the facility or specific policies and procedures. In summary, the National Guard will support the current staff that we have as we try to deal with the COVID spike within our jail. We did have a conversation with Department of Rehabilitation and Correction last week. Myself and Prosecutor Mike O'Malley, the DRC Director, Chambers Smith, and her leadership team were on that phone call. Aside from offering the National Guard, they did become a little more flexible on their guidelines associated with the transport of sentenced inmates to prisons. Unfortunately, a large majority of the individuals who are ready to be transported to prison are in exposure or isolation at the time, which means that I can't transport them. Regardless, moving forward, we are dealing with it, and we have moved inmates to cohort appropriately with the mix that we have now. And within a couple of weeks, we should be able to get people scheduled for transport again, assuming no new COVID positive people arise in those housing units. As far as lawsuit, I'm not knowledgeable on that. I'm not sure if Chief of Public Safety Bob Corey can speak on that.
Yeah, that was.
And if necessary.
Well, let's stay with Rhonda. Any questions concerning the COVID activity in the jail and what is happening?
If I may, Chair.
Yes, ma'am.
You know, we've been through so many meetings talking about processes and what we do in our jails. I just want to ask a question that I thought we heard earlier. And that was how we intake our prisoners and how we isolate them. And everyone is tested. And if they test positive, they're isolated for a week. And I mean, it sounded like we had a very regimented process of those inmates coming to us. Same with staff, that everyone is tested. And what are we doing where we were down to, I think at one point, 0 cases, and now being as high as we are? What do you attribute that to? Given that we know that we need to be very vigilant in receiving our inmates.
Great question, Councilwoman. I think our practices have remained consistent. As the spike became present in the community, it affected our staff. Staff are, for the most part, assigned to specific floors or assignments. However, when we have large number of call-offs, that causes us to move staff to other positions. As supervisors began to become infected with COVID, what you need to know about the supervisors is they are first responders in our jail. And whenever there's a critical incident, they are the ones who run to that location. We also know that there are times when people are COVID positive, which may not be symptomatic. And sometimes the contagiousness is before the symptoms arise. So considering all that, if there's a rise in the community, there's a rise in the personnel, whether it be corrections or the medical staff, and you wear PPE all day long and you're through the jail all day long, it's very possible for that to happen, where the inmates become exposed, COVID gets spread, etc. We have had a higher average of call-offs, so that causes us to move staff around more than usual. It causes them to be spread thin among the jail, maybe covering more than one unit at a time. And when that happens, you could be touching something in one unit, moving it to another unit. So our process is good. However, it's not perfect. And as we become more and more spread thin, I anticipate that things like this could happen.
If I may follow up, Chair. So so it sounds like it's our staff that could possibly be bringing it in, given the higher increases on the outside. Are you confident and comfortable with the PPP or PPE equipment that they have? Are they not just wearing a mask, but they're actually wearing very high-tech masks that are supposed to protect them, given how vulnerable they are to inmates? Are you okay with what you've been supplied in order to try and stop the spread from those that may be bringing it in?
The PPE supplies that we have are appropriate. All the PPE materials that we use were reviewed by Metro Health, as well as the county health department when the pandemic first started. The PPE is as good as how it's worn. Sometimes you have lapses. We all see it. People pull down their masks under their nose, pull it down all the way. And quite frankly, sometimes it's an involuntary itching of your nose that could spread it as well. So I spoke about the staff, but let's just be clear that a lot of it could be coming in from the street as well. When we average 40, 50, 60, 70, not average, but take in, depending upon the day, between 40 and 70 intakes, those individuals come into the jail, they're in holding areas together. Even though we're giving them masks to wear as soon as they walk in the door, they are in the same holding area for periods of time. Some of those individuals then are released within 24, 36, 48 hours and may have already exposed others coming into the jail. We do hold all new intakes in that 7-day holding isolation area, and they're tested at least 2 times before they leave that area. But it's always possible to have false negative tests and false positive tests for that matter. And again, some inmates might not recognize that they're symptomatic to even report that they're sick. So it's not just staff, there's a variety of reasons. I don't know that we can tie it to any one thing specifically. But we also tend to move some inmates around, which causes cohorting that we would not like to see, like movement going to the court, different things like that. So then you're exposing inmates from other units to one another. It's the necessary evils of a jail, I have to say.
All right, well, it doesn't sound like you're suggesting any changes. You're doing the best you can. You've got the proper equipment. There's a spike for the most part because of the outside world coming in, and managing this is what you're doing. There's really nothing you can ask of council, no funding, no extra resources. Sounds like we're just victims of this virus, and you're doing your best. Is that what I'm hearing?
It is, Councilwoman, and I appreciate your position on that. The Correction Center has been very appreciative of the support given to it to purchase what's been needed and to understand the challenges associated in dealing with the pandemic. We will continue to do so. We will continue to move forward, and we will continue to look at different ways in order to take it on head first and make it better.
Thank you, Chair. Thank you.
Rhonda, has there been any discussion with the jail and with the governor's office regarding being inoculated against this? I would assume our medical people will be first in line there, and then our staff. Have they contacted anyone to your knowledge?
Councilman Gallagher, I myself have not received a contact on that. I have heard Metro Health Dr. Bruner talk about the Metro Health system possibly getting vaccines and the medical staff possibly receiving that, but I have not received any word about the jail staff receiving that.
Okay, if you could just keep us updated if you do hear something.
Okay.
I know it's gonna take some time, but it would make sense to me that the medical people, those first responders, senior living and congregate living and jails were all identified as the nucleus of the problem. So I would hope that the politicians in Columbus don't forget that. But I'm comfortable that they'll do the right thing. Any other questions for Rhonda regarding the COVID and what we're dealing with at the jail as far as that?
Mr. Chairman.
Mr. Miller.
Thank you to Chief Gibson. I heard from prior presentations that the 1,200 is right around the number that enables you to have every inmate in a single cell rather than having to double some of them up, which is about 150 less than the number that we're currently at, as I understand it. And my question is would getting down to 1,200 improve your ability to deal with the virus in the correction facility? And if so, are there additional things that we could do to try to help get down to that number?
Great question, Councilman Miller. We actually have had several conversations, whether it be with the courts, whether it be with the Department of Rehabilitation and Correction, with Public Safety Chief Corey, many individuals in attempts to reduce the population of the jail. As you may or may not know, there's a sheriff order that was put out to release misdemeanants, with the exception of cases like domestic violence, etc., in efforts to reduce the numbers. Unfortunately, we still have people still coming in as well. We also still have that 100+ people of DRC sentenced persons waiting to be transported that, as I said previously, I can't because they're in exposure isolation or even possibly COVID positive right now. As soon as we're able to clear those people, that will get those 100+ out as fast as we can. We've already released adult parole authority individuals in our custody. And I do know that some of the common pleas judges have made some changes to their dockets as well. So we continue to work that on a daily basis, actually, and identify some inmates that come in that maybe have significant health considerations. Assuming they don't have really serious cases, we would try to move them in and out as fast as possible, recognizing that they would be a high risk in a COVID situation. But to answer the one question about 1,200 beds, when that number was thrown out there, that was back when our COVID numbers were significantly lower. Right now, it has become very challenging and necessary to double bunk, so to speak, 7-day holding isolation. So what that means is you have 2 inmates that come in at relatively the same time, and they go into a cell together. If one was COVID positive, odds are the other one's going to be COVID positive as well. It's what we have to do currently because the majority of the rest of the jail, we need those single cells. At this particular point, I'm sure you realize that the majority of our inmates are some very significant cases. A lot of them cannot be housed necessarily with another inmate. So the sheer classification of those individuals requires a single cell housing situation. Dr. Bruner and myself have talked closer to the 1,000 number, and there's been discussions about that as well. I understand the judges are having difficulties and challenges with that because they don't want to release persons with significant violent crimes from jail. So we've been working on it daily to try to get the number down.
So, Mr. Chairman, Ms. Gibson, I appreciate that detailed response, and that's very helpful. And I have heard the reports that we've gotten down to a situation where a good percentage of the people in the jail are pending serious accusations, and the fact that trials have been suspended is a problem. But that having been said, I also don't want to see a relatively modest crime become a death sentence, and so I would just ask that we try to be as creative as possible and think outside the box and consistent with safety, try to move out as many as we can and improve our capacity to get it under control. And I appreciate all the efforts that you're putting forward.
Thank you, Council.
Any further questions for Ms. Gibson?
Just one, Chair.
Yes, ma'am.
Who is the advocate for our jails to the governor? Who, it sounds like Director Gibson is saying, I've heard, but not really in direct contact with, and probably not her place to be, but who would you say? I mean, we have our nursing homes, our first responders, those that are weak in fighting this off, elderly, but who is fighting for the staff and the first responders that are coming into the jails?
My understanding is that the governor has placed the responsibility for all of that with the local health facilities, Cleveland Clinic being the main one and Metro Hospital being the other one. I believe the storage facilities that both are being used. I've been made aware that Metro got 1,000 doses today, that medical personnel will be given those on a rotating basis because you can get symptomatic from the shot, which could put you out of commission for 12 to 24 hours. So they have to do a rotation so they're not impacted too negatively. I would hope, and again, I hadn't heard, but I would hope that the jails and senior living places had been identified early on as petri dishes for this virus, that they would be high in consideration for the inoculation. Minimally, I would assume the Metro personnel at the jail will be first on board with getting those shots, and then they're not, I don't think they're first responder, but their responsibility is to be in shoulder to shoulder with a population that has clearly identified itself as being sickly and very susceptible to this type of disease and spread. So my hope is that the sheriff, I would imagine, is going to be the driver of that train with Ms. Gibson as the conductor. Would that be a reasonable way to think about it, Rhonda?
I believe so, Council. The Bureau of Adult Detention, which is a division of Department of Rehabilitation and Correction, is our direct contact to receive information from the governor's office. And I believe we're very fortunate for that. They have been a great resource for us and have offered to contact them should I need anything. They themselves will be on site while the National Guard is here this week, just to observe what's going on to determine if we need additional resources here. But I do not have a direct contact at the governor's office myself.
Mr. Chairman.
Yes, sir.
Just to that point quickly, the executive has his routine calls with the governor directly. And prior to those calls, he reaches out to each of his chiefs and directors for any issues of the day. So, for example, when the ODRC, we believed over-ratcheted down our ability to transport under the statutes, sentence inmates to them, the executive featured that issue in presentation directly to the governor. While, as you know, we didn't necessarily get a lot of latitude on that, those continued talks did show that we were able to move the needle. The same things with personal protective equipment, testing support, et cetera. And now I know that one of the things that the executive will be reaching out to the governor on is exactly what you said, is where are the jails at on the list for inoculation?
And beyond the medical staff, you have correction officers, anyone that is in the front lines, I would think would be included. You can't just, there's more than just nurses and those taking care of those that are ill, but also those that are there that are overseeing the jails. All personnel, I would think, would be in line for the vaccine in order to keep the COVID down in those very tight quarters.
Agreed. I mean, it's one of the reasons why we need the National Guard, because we have upwards of, Rhonda, I don't know, are we above 50 COVID positive correction staff, up from an average of, say, 10 during the summer months?
Yeah, HR list today said 69 as of 12/14 were out for COVID-related reasons.
Much higher than I even thought.
Okay, thank you. I appreciate it, and I appreciate all the work that you're doing.
Thank you.
Anything further? Okay, thank you, Rhonda. And finally, Bob, I don't know if you can touch on this, but the lawsuit that we filed against the Department of Corrections, do you have anything to say, or is it best left unsaid?
No, it's okay. Now, Rhonda touched on the fact that because of the litigation, and really, I think in combination with the fact that when we filed the litigation, I want to say that we had approximately 30 COVID positive or less in the jail. And by the time it was fully filed and we turned around, we were at 150. Now we're at 300. As a result of that, using the litigation and the pending litigation, Prosecutor O'Malley collaborated with the Chief of Staff under the executive, and then Prosecutor O'Malley reached out directly to the governor, and he said, I've been telling you this is going to happen. This happened. We had to file the lawsuit as a result of it. Now we have, at the time that conversation occurred, I think, Rhonda, was 180. Now we're 300. Everything that Dr. Boutros told us was going to transpired. We went from 10 to 300 in the blink of an eye. I think the lawsuit, together with the facts, which is the spike in the jail of COVID positives, consistent with the community spike, sensitized the governor's administration to what was going on in our jail. As a result, Rhonda touched on some of the points of agreement where they have relaxed testing requirements and quarantine and isolation requirements for quicker transport. In addition, we've gotten good cooperation from ODRC on taking our adult parole authority holds out of our jail, and a bus came yesterday to take upwards of 20 of the adult parole authorities. And in addition to that, as you know, the governor presented us with the National Guard help. So based upon all that, the executive, in consultation with the Chief of Staff Bill Mason and Prosecutor O'Malley, and together we all agree that it's time to dismiss the lawsuit because we got everything that we need. That lawsuit now is going to be dismissed today. We're very happy with the results that we have achieved with ODRC.
Thank you. Any questions for Mr. Khoury? Thanks, Bob. I know that was an extraordinary step that had to be taken, and I applaud all of you that led that charge to do that. It's not the easiest thing in the world to deal with government, and us being part of government, I understand that. But to deal with downstate government is a particular skill, and I'm really happy that turned out that way. And to remind the committee, the dealing with population at the jail is really a machine of many moving parts. But I like to remind people that police officers put you in jail, but they don't keep you in jail. Jailers don't keep you in jail. The only people on earth that keep you in jail are the judges. And the judges have to understand, even in the world of COVID, that we've got to move people that don't necessarily need to be incarcerated, don't need to be in our jail. And the action that the sheriff took, I think, and anybody can correct me, I think it's historical that our county sheriff had to release prisoners. I know it's happened in other counties, Medina coming to mind when they were having problems down there with an antiquated jail. This overcrowding of the jail is really unacceptable, and it's a very difficult issue to deal with. It's a delicate issue to deal with because you're dealing with other elected individuals that have, quite honestly, control over what they do. And we can't force people to do things that they necessarily don't want to do. But when it comes to the sheriff releasing prisoners, because of that domino effect not occurring, we're in a really bad spot. I know Mr. Miller is always harping on the amount of jail cells that we'll be looking at a new facility. And he's right. We don't need a huge facility, but we're going to need a facility that's going to be able to handle situations like we have right now. It's not ideal, but you have to be prepared. So there's a meeting of the minds somewhere in the middle, and I anticipate that we'll accomplish that goal. But thank you very much, everyone, for participating today. I don't believe we have any miscellaneous business. Anybody have any miscellaneous business? This will be our last meeting this year. We didn't anticipate this, but I want to thank everybody for the year. We dealt with some very difficult and very delicate situations. We did the best we could. I think we came out on top on many things. I look forward to the future, whatever that may hold for the county council and the administration. I'd like to wish everybody a Merry Christmas, a Happy New Year if our paths don't cross Friday. And having nothing else to be said, thank you. We're adjourned.
Thank you.
Thank you, Mr. Chairman, for your service.